Good afternoon. My name is Annette Hildebrand, and I'm going to discuss social networks and their impact on health. So what is a social network? Well, it's a social structure made up of nodes, usually individuals or organizations, that are connected by specific types of shared traits. These could be familial, they could be common interests, they could be beliefs, they could be social status, they could be political. An example of, actually a good example of a cyber network and its power that resulted in social upheaval that became the Arab Spring this past year. Or think of the potential power of a social network to influence the cultural practices of the countries that are dealing with the current Ebola outbreak. Social networks have evolved as our familiarity and comfort with the World Wide Web have evolved. Since their introduction, social network sites such as Facebook, YouTube, and Twitter have attracted millions of users, many of whom have integrated these sites into their daily life. There are thousands of social network sites with various technological characteristics that support a wide range of interests and practices. While their key technological features are fairly consistent, the cultures that emerge around social network sites are varied. Most sites support the maintenance of pre-existing social networks, but others help strangers connect based on shared interests, political views, or activities. Some sites cater to diverse audiences, while others attract people based on common language or shared racial, sexual, religious, or nationality-based identities. Sites also vary in the extent to which they incorporate new information and communication tools, such as mobile connectivity, blogging, and photo or video sharing. There was such an explosion of social network sites that in 2003, Business Magazine declared social network applications as the hottest new technology. Here's a chart of some of the most common social network sites, the estimated number of users, and as you can see, they have various attributes that make them unique functionally. For example, Twitter, it's restricted to only 140 characters, and it's primarily a news feed. So things like press releases, announcements, and it could supplant traditional news in the sense of news broadcast formats. Facebook, primarily recreational, and that's a peer-to-peer social network where you can upload information about things that you're doing, pictures, staying in touch with family, etc., etc. Professional organizations such as LinkedIn is primarily peer-to-peer networking based on your profession. Blogging, it's kind of like how we used to write in little booklets what our thoughts were, what we thought about certain things. So it's basically an online diary. Social networks, they define our individuality. We subscribe to and what we follow, what we share, what we watch, what we tweet, and what we post is reflective of who we are. Attributes such as our race, gender, educational level, and socioeconomic status also determine what social network sites we connect to and how we interact with others on the web. So what role do these interactions play in how we manage day-to-day life and our well-being? Poet and pastor John Donne famously proclaimed that no man is an island. It was true in his day, and because our society has become increasingly complex and interdependent over the ensuing 400 years, it's certainly true today. Studies in the modern era show that people can be good medicine, and that individuals with strong social supports, whether family, friends, or even online social outlets are healthier than those who are lonely and isolated. Married men, for example, are healthier than their single, divorced, or widowed peers. It's easy to understand how face-to-face interactions can be beneficial, but research suggests that social interactions have a ripple effect that extends far beyond household and family units. Some of these effects can promote health, others can be detrimental, but whether good or bad, community-wide effects of social networking give new meaning. By 2004, Yahoo Groups had more than 25,000 electronic support groups listed in its health and wellness section. Facebook and Twitter search showed 216 breast cancer groups, 171 colorectal cancer groups, and 527 diabetes mellitus groups. These sites are primarily designed for individuals with similar diagnoses or disabilities to share experiences, gather information, and provide support for others. People are interconnected, so their health is interconnected. In recognition of this social fact, there has been growing conceptual and empirical attention over the past decade to look at the impact of social networks on health. So let's talk a little bit about social networks and their influence on health. And we'll use obesity as an example. Obesity is an enormous health issue in the United States. About every 2 of 3 Americans are overweight or obese, so it's no stretch to say that it's reached epidemic proportions. But is it possible that social interactions play a role in obesity and that the obesity epidemic is in part a contagious disease? Well, a study from researchers at Harvard suggests that the answer might be yes. So they evaluated a little over 12,000 people as part of the Framingham Heart Study. And they found that if one sibling became obese, the other sibling had a 40% chance of becoming obese. If one spouse became obese, then the other spouse had a 37% chance of becoming obese. Now, you could say that genetics or shared meals and lifestyle habits might explain these links. But the scientists also found that if a person had a friend who became obese, their chance of becoming obese increased by 57%. So why do they think obesity spreads in social networks? Well, the effect extends beyond the impact of genetics and shared environmental influences. Although scientists don't fully understand how obesity spreads, they suspect a major factor is that a social network influences what its members perceived as normal and acceptable. So if a person sees their friends becoming obese over time, they may accept weight gain as natural, even inevitable. Instead of exercising more or eating less, their own weight begins to creep up. So they simply go with the flow and join the crowd. So in this sense, social networks give a skewed perception of what is acceptable, especially in the case of obesity. Now, by the same token, these researchers found that happiness can also become contagious, that over 4,000 people reported a total of 53,000 social ties, family, friends, neighbors, coworkers, and online connections. The Framingham study confirmed that the strongest determinant of whether a person will be happy in the future is how happy they have been in the past. It also confirmed that healthy people tend to be happier and educated people tend to be happier, that the health and well-being of one person influences others, and this can transcend into cyber networks. They also found that unhappiness does not spread across social networks. So we all know that when people observe emotions, they can be contagious over a very brief time frame. However, when this is actually documented in a social network, that this happiness can actually spread. They did also see that happiness is more readily spread between members of the same sex, and it can also reach across more than 3 degrees of separation, spreading from friend to friend to friend. Since happiness and optimism are linked to better health and improved longevity, contagious happiness might have a beneficial effect on the health of an entire community. Interestingly, the Framingham study found that unhappiness does not spread across social networks. So there is such a phenomenon called malignant loneliness, and social isolation is a well-established heart attack risk factor. While strong interpersonal ties and community activities appear to be protective against heart attack. Studies also show that marriage appears to improve prognosis of prostate cancer, but it's not clear that social isolation is a cancer risk factor. So in 2009, a University of Chicago study showed that isolation may have the detrimental effect, at least in female rats, where those raised in isolation had a 3-fold increase in the risk of breast cancer, and their tumors were much more aggressive. But cancers that developed in the community dwellers, the cancers were less frequent and less malignant. They do conclude that excessive stress may have been an explanation. But natural social networks have a substantial impact on health. And if doctors could learn to harness these social networks to benefit health, positive attitudes and wise lifestyle choices may be promoted through communities, and they can actually improve public health. So there are negative aspects of social networks. And an Italian study shows us that of 50,000 people surveyed, they concluded that online social networks have a significant negative impact on individual welfare. This had to do with the fact that face-to-face interactions allow people to place trust in one another more strongly, and that trust is correlated with well-being in a positive way. In other words, if you trust people and have lots of face-to-face interactions, you will probably assess your well-being more highly. And the fact that online social networks do not allow for that building or that placing of trust in other people, that it has a negative impact on our welfare. The other thing is that this Schools Tackle Social Media is actually a headline, and I'm sure we've heard stories about cyberbullying and how the fact that social networks can influence its members as to what they perceive as normal and acceptable can sometimes go awry, in that groups of individuals will gang up or bully other students and have negative consequences. There are also articles out there on managing your social network addiction. Apparently, social network addicts spend too much time on their websites, and with that comes negative impact of their ability to interact in person with other people. So another thing is that there's a culture of silence, that social media, a Pew study has shown that despite the boom in social media usage, that people were not willing to discuss controversial topics for fear of isolation or being ostracized in social media. And what they found was that Facebook and Twitter users were were less likely to voice their concerns during interactions if they felt their friends or their followers would not support their viewpoint. So, but what they found was that this fostered kind of a silence on the net where people would not post their opinions. They also found that if people believed their audience would agree with their thoughts, then they were 3 times more likely to share their opinions. However, the fear of isolation, being disagreed with, or becoming ostracized by social media and followers and friends is evidently a real concern. This is an eye-opening look at the potential for self-censorship on the web and possibly a means of helping to overcome that censorship. So it was found that healthcare professionals are among the group of people who make minimal use of social media to extend their relationships with patients. So here are a few recommendations for healthcare use of social networks. Start by putting social in social media. 47% of surveyed American adults report using peer-to-peer social networking as an outlet, as a recreational tool to help them connect with other people. The other thing is collaborate. Use knowledge management forums and discussion boards. 20% of Americans surveyed said they had posted to bulletin boards. So healthcare providers and healthcare networks can use this to propagate and to share information and new ideas through online networks. They should also share experiences and encourage patients to share their experiences. The other thing too, healthcare providers are perceived by Americans as some of the most trustworthy populations. So they should honor that trust barometer and always follow professional standards. So healthcare organizations can use social networks to reach stakeholders, share information, and leverage collaboration of these networks. They can also nurture provider-patient relationships using these social networks. And these social networks can be a powerful tool for influencing behavior. The power of using social networks is to take advantage of the connections people have with each other. They have considerable potential value because they can reach stakeholders, aggregate information, and leverage that collaborations. Social networks are here to stay. More research, though, is needed to completely understand and harness the positive effects of what social networks have to offer.